All right, let's talk about a massive global health crisis that isn't a virus, but it's spreading almost like it is. It's the epidemic of what are called non-communicable diseases. And today, we're going to dig into how the most powerful weapon we have to fight it isn't some numerical drug, but something we all have access to: the right words.
So, to start, I want you to just think about a number. It's a number so big, it's kind of hard to even wrap your head around. That number is $47 trillion. That's the projected economic loss, the hit to the global economy from just 5 of these diseases by the year 2030. This isn't just a health problem, you see. It's an economic catastrophe just waiting to happen.
So, what exactly are we talking about here? Well, they're called non-communicable diseases, or NCDs for short, and you definitely know someone affected by one. We're talking about the big four: heart disease, cancer, diabetes, and respiratory diseases. I mean, think about it. As far back as 2008, they were already causing 63% of all deaths on the entire planet. But here's the really crucial part. They are so often linked to things we can actually influence, like our diet and how much we move our bodies.
Now, here's an idea that really changes everything. You can't catch diabetes from a friend in the traditional sense, right? But get this, research shows you can absolutely catch the behaviors that lead to it. Poor eating habits, not getting enough exercise. These things can spread through our social circles, almost like a trend. And if that's true, if bad habits are contagious, it means something incredibly hopeful. Good habits can be too.
You know, a problem this big can't be solved by just one person at a time. It demands a global response. It required a moment where world leaders had to come together and really face this multi-trillion-dollar threat head-on.
And if you want to know just how seriously the world was taking this, just look at this timeline. In 2011, the United Nations held a huge meeting dedicated entirely to NCDs. This was only the second time in the entire history of the UN they had ever done this for a health issue. The first time, 10 years before that, for the HIV/AIDS epidemic. I mean, that tells you everything you need to know about how urgent this crisis had become.
So, what's the alternative to losing $47 trillion? Well, it's the cost of prevention. To actually put proven programs in place in the hardest hit countries, it would cost about $11.4 billion a year. And that breaks down to just $1 to $3 per person. So you see, the question isn't really, can we afford to act? It's, can we really afford not to?
Okay, so global meetings are one thing. They're super important. But the real fight, the real change, that happens on the ground. It happens in our towns and our communities. So let's zoom in and look at a program that's actually making a difference, one that's turning these big ideas into real-world action.
It's a program called EPODE, and it started in France with this simple but really powerful idea. What if we made the healthy choice the easy choice? This was not about just handing out pamphlets at a doctor's office. Nope. It was about creating a whole ecosystem of health, getting everyone from the mayor's office to the local grocery store working together to support families. So, what was their secret sauce? Well, it really boiled down to these 4 key ingredients. First, they got political buy-in at every single level. Second, they based every action on solid scientific evidence. Third, they used smart, positive marketing to make healthy living seem cool and appealing. And finally, and this is the real magic, they made sure everyone was rowing in the same direction. And the results? They were just stunning. In just 4 years, the pilot towns saw a nearly 10% drop in the prevalence of childhood obesity. To get that kind of positive change across an entire community, that's incredible. And it just proves that this kind of coordinated, all-in approach can have a massive, massive impact. So, we've seen how whole communities can change. But what about us, as individuals, as families? Because at the end of the day, these huge societal shifts are built on the small choices that we all make every single day. And that is where the power of clear communication really, really comes into play. Let me just ask you a question. Do you really, truly know what energy balance means? I mean, sure, most of us have heard the phrase calories in, calories out, but there is a huge difference between just hearing a term and really understanding how to apply it to your own life. Okay, look at this data from Europe. 70% of people say, yeah, I'm familiar with calorie recommendations. But then, when you ask them how many calories they personally need, less than half can actually get it right.
This is what we call the calorie disconnect, and it's the perfect example of why just throwing information at people doesn't work. We need communication that leads to real understanding and then to action. So how do we bridge that gap? Well, it turns out it's not about telling people to completely overhaul their entire lives, which just feels impossible, right? Instead, the research points to a much more effective strategy, focusing on small, sustainable changes. Something as simple as reducing your intake by just 100 calories a day, that's like one less cookie or switching a soda for water, can make a huge difference in preventing weight gain over the long run. It's realistic, and it actually works. And this right here is what that kind of communication looks like in practice. It's simple, it's positive, and it's actionable. Know Your Number gives you a clear, concrete target. Small steps equals big changes makes progress feel totally manageable, even rewarding. And you are a role model? Well, that connects your own actions to a powerful purpose. This is how you empower people, not overwhelm them. So, what's the common thread through all of this? From the highest levels of global policy, down to these amazing community programs, and all the way to the choices we make in our own kitchens, a clear set of rules for effective communication starts to emerge.
And here they are, the 10 keys to actually motivating healthier lifestyles. Just notice how encouraging and practical they all are. A couple of my favorites are number 4, focus on how to do it, not just what to do. That's all about giving people tools, not just a bunch of rules. And number 7, all physical activity counts. It's not about being perfect, it's about participating. It's about celebrating every small step and just building a real culture of wellness.
And that really brings us to our final thought. We know what works. We know that these simple, positive, actionable messages can literally change and save lives. So the question we're left with isn't really about the science anymore. It's about us. If we know what works, what's stopping us from putting this knowledge to work everywhere to build a healthier world for everyone?